You received a diabetes diagnosis, and now you're probably asking, what next? It's a completely normal question, and today we're going to break down everything you need to know to take control of your health. Welcome to the Diabetic Voice. We are not doctors, but we have been successfully managing our own diabetes for 10 years. Please subscribe to our channel so we can provide more information to help you thrive on your diabetes journey. Getting a diabetes diagnosis can feel like a punch to the gut. You might be feeling a mix of emotions: shock, fear, confusion, maybe even anger. And you know what? That's completely normal. Take a moment to acknowledge those feelings. This isn't your fault, and it's not a death sentence. In fact, it's an opportunity to make some positive changes and live a long, healthy life. The first step is acknowledging where you are right now. Think of managing diabetes as a team sport, and you're the star player. You're going to need a strong team backing you up. Your primary care doctor. They're your home base, overseeing your general health and making referrals to specialists. They're your first point of contact for anything related to your diabetes. Endocrinologist. If your diabetes is complex or you have type 1, an endocrinologist is a hormone expert who will be key. Certified Diabetes Educator, or CDE, this person is your absolute MVP. They'll teach you everything from monitoring your blood sugar to understanding your medications and coping with the daily challenges. Think of them as your personal diabetes coach. Registered dietitian, or RD food, is a huge part of diabetes management. An RD will help you create a personalized meal plan, teach you about carb counting, and guide you on healthy food choices without feeling deprived. Exercise physiologist. They can help tailor a safe and effective exercise plan just for you. Pharmacist. Don't underestimate your pharmacist. They can explain your medications, potential side effects, and any interactions. You might also see an eye doctor or ophthalmologist, a foot doctor or podiatrist, or a heart doctor or cardiologist as part of your comprehensive care. Action item. Schedule an appointment with your primary care doctor and ask for referrals to an endocrinologist, a CDE, and an RD right away. These professionals will be instrumental in your initial learning phase. Once your team is in place, you'll start working on your personalized treatment plan, setting your targets. You and your healthcare team will establish specific blood sugar targets, like your HbA1c levels and your pre- and post-meal blood sugar ranges. These are your personal goals. Medication, if prescribed, whether it's pills or insulin, understand exactly what your medications are, how to take them, and what side effects to watch for. Never skip a dose, even if you feel fine. Consistency is key here. Monitoring your blood sugar. This is your daily report card. You'll learn how and when to test your blood glucose levels using a glucose meter. This data is invaluable because it shows you how different foods, activities, and stress levels affect your blood sugar. Keep a record of your readings. Many meters now connect to apps, making this super easy. Pro tip: don't be afraid to ask questions about your medications or monitoring devices. The more you understand, the more empowered you'll feel. This is where you take charge. Lifestyle changes are the foundation of diabetes management. Eating for health doesn't mean deprivation. Focus on whole foods. Think colorful vegetables, lean proteins like fish and chicken, beans, whole grains, and healthy fats. When it comes to carbs, remember that they have the biggest impact on blood sugar. Your dietitian will teach you about portion control and choosing healthy carb sources. This isn't about cutting carbs completely, but about making smart choices. And say goodbye to sugary drinks. These are public enemy number 1 for blood sugar. Move your body, find what you love. Aim for 150 minutes of moderate intensity aerobic activity per week. Think brisk walking, dancing, swimming, or cycling. Add strength training 2 to 3 times a week, since this builds muscle, which helps your body use insulin more effectively. If you have a desk job, try to get up and move around every 30 minutes. Even short bursts of activity add up. And always talk to your doctor, especially if you're new to exercise or taking blood sugar lowering medications. So when it comes to weight management, if you're overweight, even just a small amount of weight loss can, honestly, make a big difference in improving your blood sugar control. And, stress can really send your blood sugar soaring, so it's important to find healthy ways to cope. That could mean meditation, yoga, spending time in nature, or even indulging in a hobby you love. Now, prioritizing sleep is also huge. Poor sleep can really mess with your insulin sensitivity, so try to aim for consistent, quality sleep every night. And if you smoke, kicking the habit is one of the very best things you can do for your health, since smoking drastically increases your risk of diabetes complications. When it comes to alcohol, just be mindful. If you drink, do so in moderation, and always be aware of how alcohol can affect your blood sugar. It's definitely a good idea to discuss this with your doctor. Just remember, these aren't temporary fixes. These are sustainable lifestyle changes that will benefit your overall health way beyond just managing diabetes. Regular doctor visits are important, especially at first. You might see your doctor every 3 months and then maybe every 6 months once your blood sugar stabilizes. Annual screenings are, honestly, non-negotiable. You'll want to have your cholesterol and triglycerides checked every year. A comprehensive foot exam is vital to catch any problems early. And don't forget a dilated eye exam. Diabetes can affect your eyes, so a yearly exam is a must. Also, kidney function tests, both urine and blood, are important to keep an eye on your kidney health. It's really important to stay up to date on your vaccinations. Make sure you get your flu shot every year and talk to your doctor about COVID-19, pneumonia, and hepatitis B vaccines. Your immune system can be a bit more vulnerable with diabetes. Dental health matters too. So brush and floss daily, and have regular dental exams since diabetes can increase your risk of gum disease. At home, make it a habit to check your feet daily for any cuts, blisters, redness, or swelling. If you notice any non-healing sores, it's important to contact your healthcare team right away. Managing your blood pressure and cholesterol is also key, since these are often linked to diabetes and can increase your risk of complications. So work with your doctor to keep them in check. And you know, it's totally okay to ask for help. A diabetes diagnosis can be emotionally challenging, but you're definitely not alone in this. Reach out to friends and family, and consider joining a diabetes support group, either online or in person. Hearing from others who really understand what you're going through can be incredibly validating. And if you're struggling with feelings of sadness, anxiety, or just feeling overwhelmed, don't hesitate to talk to a mental health professional. Taking care of your mental well-being is just as important as your physical health. So final thoughts, really, you've got this. Getting a diabetes diagnosis is a turning point, but it's one you can absolutely navigate successfully. By educating yourself, building a strong healthcare team, embracing healthy lifestyle changes, and staying consistent with your monitoring and screenings, you can live a full, vibrant life. Remember, it's a journey, not a sprint. Be patient with yourself, celebrate your small victories, and just know that every positive step you take is a win for your health. If you found this video helpful, please give it a thumbs up, subscribe for more health content, and let us know in the comments below what topics you'd like us to cover next. You are not alone on this journey. And if you enjoyed this video, go ahead and click on the next video to learn about some grocery shopping tips.